So as Hanan said, my name is Dr. Yap. I'm a consultant heart surgeon in KK Hospital and National Heart Center. I do both congenital heart disease surgery and acquired heart disease surgery. Yeah, so while waiting for the slides to show, just let me explain a bit. I mentioned about congenital heart disease and acquired heart disease. So congenital heart disease is those heart diseases that you are born with. Acquired heart disease is something that you acquired at the later stage of life. The easiest to understand is acquired heart disease is like blockages in the heart vessels, what we call heart attack, what the layman people refer as heart attack. The congenital heart disease is like a hole in the heart. So I think we can go to the next slide. So congenital heart disease is an extremely complex problem. I hope you all can see the slides. So to explain, to give a few examples of common congenital heart disease, you can see in the, so I can't point my pointer to the slide, but if you see in the middle, there's a big heart. It says normal heart. So usually in my clinic, I will explain to the patients how the normal heart works. Then I explain to them their congenital heart problems. So I'm sure most of us know how the normal heart works. If you can see the heart, there's a blue portion of the heart and there's a red portion of the heart. So the blue portion of the heart is called a right heart, in the right side of the heart, and the other one is the left. The blood, usually the heart will pump the blood to our body, to all the organs, and all the organs will use the oxygen of the blood. Then the blood with low oxygen, you will turn blue. The blue blood will then come back to the right side of the heart. Then then the heart will pump the blood to the lungs. Then the lungs will give oxygen to the blood. Then it goes to the left side. It becomes a bright red color. Then it goes to the body. So in the normal heart circulation, the right heart, which is a blue color heart, will pump blood to the lungs. The left heart, which is the heart with the bright red color, will pump blood to the whole body. Okay, so this is the normal circulation of the heart. To give you a few examples of the congenital heart problems, it can be a simple problem like a hole in the heart. Like if you look at the right side, there's a ventricular septal defect. It means that there's a hole in between the blue chamber and the right chamber. So if you have that problem, the blood will flow from the red color to the blue color. Because the pressure on the left side of the heart is higher, then you have a lot of blood in the lungs. So in this problem, if the hole is very big, if the hole is very big, the babies are born with a big hole. Usually they'll get into trouble within first year of life. They cannot grow. They will feel breathless because the lungs have a lot of blood. Then the baby needs to have something done to get them to grow bigger. So that's one example. If you have a hole in the heart. The second example would be what we call a tetralogy of Fallot, the one on the right side of the screen, the most right. So tetralogy of Fallot is you have a hole in the heart, but then you also have a narrowing of the blood vessels, of the blue color blood vessels. So there's an obstruction. So the blue blood now, because it can't go to the lung due to the obstruction, the blue blood now will go to the red color chamber. So the red color chamber, the blood will mix, and then they will send the blood to the baby's body, so the baby will look a bit blue. So this is another form of tetralogy of Fallot. The one that next to it is called hypoplastic left heart syndrome. So this one, like I explained before, our heart has got two big chambers. One is the red color one that will pump blood to the body. One is the chamber will pump blood to the lungs. In the hypoplastic left heart syndrome, the the red portion of the heart is very small. When the baby is born with a very small heart of the left side, the body doesn't get enough blood. Then the baby is in trouble. In this kind of situation is one of the most complex problem that we have to face with. In the next slide, I will explain to you what kind of surgery we do for this kind of patient. On the left side of the screen is called coarctation of the aorta. Sometimes the heart itself is okay, but the blood vessels, the red color blood vessels, there's a narrowing there, and then that will cause some problems to the heart and the body because the body cannot receive enough blood supply. So overall speaking, congenital heart disease is a very complex problem. It can range from a small defect that we can easily correct it, and then the baby will grow with a normal prognosis, normal life expectancy, to a very severe defect that if you don't do the surgery, within 1-2 weeks after the baby is born, then the baby may not survive. So it's a very complex and very wide range of disease. Can you go to next slide? And sometimes I did my specialist training in congenital heart disease in Toronto, Canada. So in some patients, we do have to put in an artificial heart, and some patients we do have to do a heart transplant at the early age or even at the old age. It's a very wide, complex problem. The next slide is I just want to ask this slide. Basically, I just want to explain that in the congenital heart disease, we do need to have a team of doctors. They are cardiologists and they are heart surgeons. So I'm the surgeon. The surgeon, we will do typically an open heart surgery. Means we have to open the chest, get to the heart, open the heart, and do some form of repair. But sometimes sometimes some patients, they don't need to have an open heart surgery. The hole can be closed by what we call a intervention. Means the cardiologists. Cardiologists are different group of doctors. They can put a wire through the groin into the heart, as you can see on the right side of the screen, and they can actually close the hole through a device, so you don't need to have an open heart surgery. That will be done by cardiologists, not the surgeon. The left side of the picture, mainly I want to show you, when we talk about hole in the heart, is actually not that simple, because the hole of the heart, the treatment of it can be different. Depends on where the hole is, depends on how many holes are there, and the size of the hole, and whether the hole is near to any of the important structures of the heart. So we do need to have a heart team that we discuss every week, at least once a week, to decide the best management option for the patient. And I think we can go to the next slide. So in this slide, I don't want to complicate things. This slide, basically, if you remember my previous slides, we talk about one of the most complex surgery is our heart has got a blue color and a red color. In this situation, the red color heart is very underdeveloped, very small, so it cannot send blood to the body. So in this picture that I've shown you, it's called a Fontaine operation. What you are seeing is the heart. This heart that you are seeing is red in this picture, but what it shows is actually the right heart, supposed to contain the blue blood. So we have to do multiple operation to direct the red blood to this heart, the only heart that the patient has, and then send blood to the body, and then we need to reconstruct a tube to substitute the missing heart. It's quite a complex operation, and multiple times. Usually we have to typically do 3 operations. First one is done within weeks after the baby is born. Second one will be done 4 to 6 months. The third one, the final one, will be done about 3 to 4 years. And then after that, the patient needs to have a lifelong follow-up. Some of the patients eventually will need to have a transplant. So this is one of the most complex heart operation that we have to do. And it's quite challenging for everybody, for the surgeon, for the cardiologist, especially for the patient and the family to go through this journey actually. Currently in Singapore, in heart center, in Singapore, we have got two centers that do congenital heart disease. One is SingHealth, which is a heart center and KK, and the other one is National University Hospital. In the SingHealth heart center adult population, currently we have got about 40 patients that we look after that has got this kind of circulation as an adult. Can go to the next one. So the topic is like the cardiac surgeon's perspective for congenital heart disease. As I mentioned before, the disease is so complex. So we do need to have a team of doctors specialized in congenital heart disease. They are the cardiologists, the surgeon, anesthetists, ICU care doctors, nurses, perfusionists, and radiologists. So we do need to have a very, very big team of doctors to look after the patient. And from my perspective, I think I'm just one of the team members that help to manage the problem, because some of the patients don't need heart surgery, but they do need to have some form of other cares in cardiology or intensivist. So as a cardiac surgeon, my job is to I'm just part of the member in the team. When the babies need surgery, I will need to give some advice. I need to study the patients. And I need to give the opinion in the meeting to help my other colleagues to make the best decision for the patient. Congenital heart surgeon is a very unique surgeon because I think we are the only surgeons in the cardiothoracic team. We are the only surgeons that we do both pediatric heart surgery and adult surgery in heart center. So we do see as a surgeon, we do see a very good continuity, because as a surgeon, we look after the babies, the patients from the baby stage all the way to old age, when they are old, because we do look after them. The rest of the team members is different from For example, in KK, we have got a pediatric cardiologist. We have got pediatric intensive care, pediatric nurses. But then in National Heart Center, we do have a separate team of heart team. So the heart surgeon, we are the only one that go around both sides, which is unique for a surgeon. The next slide. Yeah, this is I got this picture from Google. Actually, I'm not too sure which hospital, but this is our daily life as a congenital heart surgeon. Although we think the surgery is done by the surgeon, but actually it's not. If you look at the picture, we have got the one that's sitting down is actually a perfusionist. The ones that have got all the scrubs up, standing there, they are the main surgeon is there. You do need to have a nurses and a surgeon assistant, anesthetist. It's never a one-man job. It's actually a team of highly trained and dedicated people in the team. Just want to show you, this is our daily life in the operating room. And you can see the red color lines. Those are the heart and lung bypass machine. We connect the baby, or we connect the patients to a heart and lung machine, so the machine can act like a patient's heart and lung while we stop patient's own heart to do operation on the heart. Next slide. So the congenital heart disease in Singapore, Singapore is first of all, congenital heart disease is not common. 8 over 1,000 in Singapore. Singapore itself is a small country. So compared to other countries, for example, I went to Toronto, is a very big country in Canada. they have much more cases than us. In Singapore, our cases are not a lot. In KK, the fetal heart program, or one of the reasons in Singapore is a well-developed country, so we do have a very good fetal cardiac program. Means that fetal means that the baby are not yet born. They are still in the pregnancy. So in the pregnancy, the doctors, some of them, they may be able to diagnose the heart problems during pregnancy. Then they will send the babies for fetal cardiac program, which is not involved. As a cardiac surgeons, we are not involved in the fetal cardiac program. But usually the cardiologist will then do the scans and counsel the patients. And some of the parents in Singapore choose to terminate the baby if there's a very serious heart problems. So I was going through the data. KK has a fetal heart cardiac program, and they do receive 160 to 180 cases a year for those pregnancy who are suspected to have problems in the baby's heart. And when after the babies are born, those that need heart surgery in pediatric age, KK hospital, we do about 100 cases a year, and then we look after them when they reach age 18 years old. And the age, I think, is different from male to female, but around 18 years old, those patients will be transferred to National Heart Center, the adult congenital heart surgery team. In National Heart Center, we do about 40 cases for adult who have got congenital heart disease. Some of the congenital heart disease are diagnosed during adult stage. We do get some of them from the SAF program, screening program, and so not all of them are diagnosed when they are children. Some of them are diagnosed when they are adult. Next one. I think Singapore, the one thing to mention that actually in this region, Southeast Asia region, Singapore has got a very good access to healthcare for congenital heart disease. I know in Malaysia, there are a lot of patients who are born with congenital heart problems who cannot get to the heart surgery, and a lot of them actually pass away while waiting for treatment. So in Singapore, we are lucky to have a good healthcare program. So I explained a bit in heart center. We do have 4 surgeons who do adult congenital heart surgery. One of the examples is we can do a simple, we call it simple, but I'm sure to patients it doesn't feel that simple. Open heart surgery, the hole in the heart, we can fix it through an open method, which is the left side of the picture. You can see there's a scar down to we open the breastbone, and it's called sternotomy. Or nowadays, the new approach is we can actually go through what we call around the armpit there, the right side, the side of the body, around the right armpit. We call it a minimally invasive surgery, so the recovery can be faster too. You can go to next slide. Or in heart center, in the adult congenital heart surgery in heart center, we can also do a complex redo valve surgery. The picture actually show you that this is one of the diseases that I talk about called tetralogy of Fallot. Usually they are born with a small valve in the blue circulation, the one that sends blood to the lungs, and because the valve is small and is obstructing the blood flow when the babies are small, and when the babies are very small, so there's no good valve that the factories make or we can find to reconstruct the valve. So sometimes we do have to cut across the obstruction and put a little white color patch there to relieve the obstruction. You can imagine in this kind of approach, the valve is damaged. But the baby can tolerate this kind of problems, and when they become adult size, they come to heart center, and we do have to change a new valve for them, which is the right side of the screen. So this is one of the things that we do, valve surgery in heart center, but we do all range of surgery actually. The next slide. So yeah, so we in heart center, in particular, adult congenital heart disease, we are dealing with a lot of aging population. So some of the patients who are born with adult congenital heart disease, they have a hole there or they have a valve problem. So nowadays, because they can grow quite old, and when they become old, they start to get the old age heart problems like a block, heart vessels, coronary artery disease, and it's become more and more complex. As a heart surgeon in heart center, in the group of congenital heart surgeons in heart center, we do both acquired heart disease and congenital heart disease. That does give us an advantage because we can, if the patient present with both combination of congenital heart problem and old age problem, we will be able to deal with them as a group. And our adult congenital population in heart center is increasing because a lot of babies who are operated like say 20, 30 years ago, and they survived so long, and our adult congenital disease patients population is going to keep increasing actually. I think that's probably the last slide already.